Yes.
Mr. Bishop, in the second half of the 70s, first half of the 1980s, approximately how big was the ARMA UK sales team?
About 5.
And we...
There were 3 in the UK, 1 in Sweden, 1 in Benelux. Oh, 4. No, another one in Ireland. Sorry.
We looked before the break at some of the formal materials, the product labels and so on, that ARMA produced. From a sales and marketing perspective, other than the correspondence to clinicians that we looked at before the break, what kind of sales and marketing materials did ARMA use, as far as you can recall?
The only materials they had were the technical bulletins, up-to-date information on their own and other products, and on the whole subject of haemophilia, nationally and internationally. That's the only things they had. They didn't carry samples or anything like that.
Who were most of your and your team's dealings with in the UK? Was it predominantly with haemophilia centre directors?
Yes.
Did you also promote and sell ARMA products to individual hospitals that weren't haemophilia centres?
Oh, no. As far as I can recall, no.
What about regional health... Sorry, Mr. Bishop, carry on.
No, there was... I mean, the UK is so well covered by haemophilia centres, whether they termed reference centre directors or minor centres. You know, most towns, I think, had a haemophilia centre.
Do you recall whether you had dealings directly with regional health authorities at all?
No, I don't recall.
And then, very roughly, how often would you expect either you or one of your team to be visiting a particular haemophilia centre?
It depended on their areas. At least once a month. Could be more frequent, depending on the circumstances.
And did you undertake your own visits to haemophilia centres?
Yes.
Can you then just describe to us how typically a visit to a haemophilia centre might proceed?
Well, there would be an appointment made, obviously, with the centre, the staff, or whoever, and they would meet with the haemophilia centre director, discuss whatever were the issues at the time. Would also make contact with the nursing personnel, because you know, they were the people invariably who actually administered the infusions to outpatients, and perhaps also physiotherapists involved in that team, depending how big the centre was, you know, that they were visiting. But it would just be, you know, a general discussion or specific discussion, whatever was appropriate at the time.
Again, this is a very general question, Mr. Bishop, but what kind of issues were the clinicians typically most interested in? Was it cost or reliability of supply, or what particular themes would come up time and again?
Well, clinical teams, so questions about the presentation or delivery or potencies available. The whole could cover the whole subject of haemophilia, ongoing nationally and internationally, because the haemophilia population, not only in the UK, worldwide, is a very, very small group of people, So they're very sort of intimately involved with each other, internationally and nationally.
And what about safety, risks of viral transmission? To what extent would a discussion of those issues feature in the regular meetings with Haemophilia Centre directors?
Well, again, it would depend on what was the state-of-art thinkings of the time. It could have followed on from a technical bulletin they'd received from our medical department, discussion on clarification on issues. We could cover the whole gambit of haemophilia care.
Can I ask you to look at PRSE 00028887?
Sorry.
Yeah, no, carry on, Mr. Bishop, before we look at the document.
Could I just point out that all the discussions that took place between our specialists and the centres were reported back on a weekly basis to head office, so that we were fully appraised of what the discussions were taking place, what concerns were being portrayed, etc. So it wasn't just a constricted discussion between a director and the rep specialist. That information was all shared with people back at head office, and then depending on the subject, it would have been also shared with the medical department as well. So I just wanted to make that point clear.
Thank you. Now, the purpose of showing you the document we're going to look at now is just so that I can ask you a little about the efforts made by ARMA to achieve sales of its product in Scotland, a country which had its own fractionation facility in Edinburgh. If we go to PRSE 3028, oh, sorry, we've got it, page 16, Showmick, of the document, my apologies. Now, these are some figures for use of products at the Haemophilia Centre in Edinburgh. I'm not going to ask you to look at the detail of it, Mr. Bishop, but it shows in 1980 and 1981 in particular, substantial amounts of ARMA's product being used in Edinburgh, and then it tails off again, and the main product being used is Scotland's own domestically produced product. Did you have any direct dealings yourself with the haemophilia centres in Scotland that you can recall?
Oh yes, we did. They were part of the UK. Hopefully they still are.
Can you remember anything about what led to Factor 8 being used in Edinburgh, in particular in 1980 and 81?
No. They were just another centre.
If we go to page 25 of this document, we've got a similar table for the Glasgow Royal Hospital for Sick Children at York Hill. And again, I'm not going to go into the detail of the figures. We've looked at it on other occasions with other witnesses, Mr. Bishop. But Factor 8 was used to a very substantial degree at this children's hospital in 1979, 1980, 1981, and 1982. Do you recall any particular discussions or visits to York Hill Hospital which led to ARMA being a favoured product there?
No, I don't recall any specific meetings, no.
Okay. We can take that down, thank you. Was there any specific or different approach taken by ARMA to promoting its product for children as opposed to adults?
No, none whatsoever. Apart from the provision of smaller potency vials.
I want to ask you then about a handful of interactions with specific haemophilia clinicians. So if we...
May I just ask, did adults get the Mr. Men stickers too?
They would have been included as a general as a general thing.
So they
Some
would.
men might have liked the Mr. Men badges as well.
Thank you.
Could we please have RFLT 5014? Now, this is a letter from Dr. Kernoff at the Royal Free Hospital to you, dear Chris, re Armour hepatitis low risk factor 8. It's not entirely clear what year it is. It's the 19th of September 1980 something. It refers to a discussion with you, and then you're asked by Dr. Kernoff for information about Armour's hepatitis low risk product. And then Dr. Kernoff sets out a range of pieces of information he wants: full specification, donor pool size and size information, donor pool source and size information, outline of the production process, results of animal experiments designed to investigate safety and efficacy, any information you have about in vivo studies in patients. Can you recall the kind of interactions that you had with Dr. Kernoff on this issue, and whether you would have provided the information that he was seeking?
Can you go back? Can you scroll back down? The title of the letter, the heading of the letter. Hepatitis low risk. I don't know what he meant by that, actually. Whether it was the whether he was referring to heat-treated product or not, I don't know. Okay. But he would have been supplied with appropriate information, and that I would have passed that on to our medical department, probably to respond to.
Okay. So if a clinician positively asked for information of that kind, you'd endeavour to supply it through your medical or regulatory affairs department?
Oh, of course, yes, of course.
If we then go to an interaction with a different clinician, this is HHFT 301201_003. This is a letter dated December the 23rd, 1980 to Dr. Peter Jones. If we go to the second page, we'll see it's from Dr. Lott, Head of Medical Services. And then if we go back to the first page, we can see it refers to a protocol. Says, I apologise for the delay. I was waiting for the additional information from your technical staff, although I understand from Chris Bishop that you were waiting for me to write. And then details are set out of what appears to be some form of study that's going to be initiated involving Newcastle and Alton, so that's Trelaws. Do you recall anything about this particular study?
No, I don't. No.
Would you have had, or do you think your colleagues would have had any particular concerns about a study involving children?
No. If that was the decision of the medical and technical people and the clinicians involved, then who was I to question it?
If we then look at OXUH 301624_003. This next letter is from Dr. Ritzer at Oxford. So we can see August 1981, Dr. Ritzer's writing to you. He refers to a letter he's received from you. Then he says, as you know, I discussed with Sue Jobb the possibility of Armour supplying financial support to enable us to continue employing a health visitor in our hepatitis studies. We're looking for an immediate source of money to enable us to bridge the gap between now and the time when the MRC will make its decision. And then if we just look at your response before I ask you about this, Seamus, it's OXUH 301624_004. This is a letter from you. If we pick it up in the third paragraph, Grateful for your comments regarding future sponsorships, and with regard to the health visitor which you discussed with Sue, I suggest we wait until the outcome of your application to the MRC and Haemophilia Society is known. Since this would create a precedent, I would prefer to leave it until this time before making any application to the Grants and Donations Committee.
Can we just go back to the previous letter, 003, and look at the date?
Oh, I'm sorry, I've got them the wrong way round in terms of time. Yes, so Mr. Bishop's letter is to Dr. Ritzer is the first letter, and then Dr. Ritzer's letter is to Mr. Bishop is sent later.
Thank you.
Thank you. If we look at your letter in response, thank you. What was the Grants and Donations Committee that you're referring to here?
That was just a local UK. We didn't have an actual committee. I think it was just a name given to that we applied at the time to cover this this unusual request.
And how common was it for ARMA to be asked by haemophilia centres for financial support?
Very, very, very infrequently.
And can you...
the exception to that would be possible sponsorship or help towards attendance at the World Federation of Haemophilia meetings, which every company supported. But requests of this were extremely rare.
And do you know what the ultimate outcome of this request was?
No, I'm afraid I don't. No.
If we then move on from 1981 to 1985, ARMO 40370. This letter is not from you, it's from Mr. Christie to Dr. Frank Hill in Birmingham Children's Hospital, 27th of March 1985. First paragraph says this: you will note from the enclosed copy letter that I paid our first 1985 donation to your research fund to the Finance Department of the Central Birmingham Health Authority. And then Mr. Christie expresses interest in the progress of the project, its extension into HTLV3 screening of children, and then there's a reference to a hepatitis B problem in the third paragraph. It would appear from this that there were regular donations, or one inference might be there were regular donations made by ARMA to a research fund at the Children's Hospital. What do you know about that?
I can't recall the details, but that would appear to be a part payment of a one-off research program, which had been which had been previously agreed with our medical technical people.
Now we
have nothing to do with marketing.
We know from other material that the Children's Hospital, or the Haemophilia Centre at the Children's Hospital in Birmingham, under the directorship of Dr. Frank Hill, used the ARMA product to a very substantial degree. Can you recall anything about the relationship between ARMA and Dr. Hill?
Well, very professional, but very, very close, friendly relationship.
Was there ever any sense that he'd buy your product, or the Children's Hospital would buy your product, and you would look favourably upon requests for support for research?
Oh no, certainly not. No. All centres, directors were treated, equally.
Were there any particular centre directors that you had more dealings with than others in the second half of the 70s and first half of the 80s?
Not really, because, as I said, they were, there were larger centres and smaller centres, and there were leading opinion formers in the larger centres, So therefore, there would have been more contact and correspondence backwards and forwards with those larger centres, because the smaller centres would invariably refer to the local reference centre before they came to us.
Going to ask you next, Mr. Bishop, about your knowledge of AIDS and its connection with blood and blood products. Can we start just by looking at your statement again, WITN 5529001? If we pick it up at the bottom of page 10, paragraph 21, this is in response to a question about what inquiries or investigations are carried out in respect of risks of transmission of HTLV3 prior to 85. You say all inquiries and or investigations were carried out under the auspices of the medical and regulatory bodies. As a sales/marketing employee, I was informed as appropriate, and any involvement I had would have been limited to acting as a point of liaison between clinicians in the medical and regulatory affairs departments. What do you mean by acting as a point of liaison between clinicians and those departments?
Well, on our normal visits and relationships, sort of normal visits with directors, there may have been some feedback of a medical technical nature, which we would then pass on to the medical and regulatory affairs department. Very often the clinicians would write or discuss it with the specialist or write directly to me because of our very good relationship, friendly relationship we had. So we would have been the first points of contact.
Now, if we take that down, thank you. The issue of AIDS must have come up in discussions with Hemophilia Centre directors in 1983 and 1984. What, if anything, can you recall about discussions with centre directors about AIDS at that time?
Well, the discussions, let's say, between our specialists and myself, that would be based purely on the state of art knowledge of the time. I can't remember, specific discussions or details of specific discussions, but it would all be related to the state of art knowledge.
Would there have been, as it were, a line to take by your sales team if they were asked about AIDS in 1983 or 1984 by a Hemophilia Centre director? Would there have been some guidance to your team as to how they should answer such queries?
No, only as a result of any position statement or document that I sent out or the medical department sent out.
Well, let's look at some of the documents relating to AIDS in 1983. So if we start with ARMO 40234, this is a memo from you, Mr. Bishop, dated the 11th of January 1983, to Hans Kjellman. Who was that?
He was in Germany, at Arno Eschwegen, in Germany.
And the subject is AIDS. And then if we look at the text of your memo, I enclose for your information articles relating to the above. And I would confirm to you that this is now of particular concern to clinicians in the UK, particularly if it's felt that regular infusions of factor VIII concentrate are the prime cause of this associated immune deficiency syndrome. Have you got any comments to make, and is it of equal concern elsewhere? So it's pretty clear from this, Mr. Bishop, that clinicians in the UK have been raising concerns either with you or with members of your team about AIDS. Is that fair?
Yes.
Do you have any recollection now of which clinicians at this point in time, beginning of 83, were raising these concerns?
no, not. I know there's some reference in many documents that have been sent through, but I don't recall any particular one at this time.
Again, in broad terms, what was your purpose in sharing this information that's come to your attention? If we go over the page, we don't need to look at the detail of it, but you're enclosing material from the New England Journal of Medicine. If we go back then to the first page in the memo, why were you raising this directly with a colleague in Germany rather than simply passing it on to your Medical Affairs Department in Eastbourne?
I don't know. That was I was just trying to get feedback from a marketing point of view from the German perspective, so that I could feed that back, to our own medical people. Our own medical department could well have done that themselves, but obviously I took it upon myself to do that.
Still in January 83, if we go to ARMO 40250_002, please. Now, this is a publication from the States. There is a date under the stamp, which is January the 17th, 1983. And it's reporting on the advice of the National Hemophilia Foundation's Medical and Scientific Advisory Council in the States. But if we look at the handwriting at the very top of the page, there's some names scribbled on there, one of which is yours, C. Bishop.
Yeah. And that's Claudia Schott and Frichter, who are both whatever, but they were both in Germany. Arma Eschwege, Germany.
Okay. So would it be right to understand that someone within Arma has identified that this is a document that should be brought to your attention and the attention of those others listed there, and that there may indeed be other names that we can't read?
Yes, because it was sent to HLS, Dr. Shaw, the medical director in Eastbourne, and also passed on to Robert Christie. Yeah.
If we
so he would have passed it on.
If we go to the third page, we can see that the recommendations themselves that have been produced in the States on the 14th of January 83, recommendations to prevent AIDS in patients with haemophilia. And then paragraph 1 is recommendations for physicians treating patients with haemophilia. And that's encouraging, in particular, the use of cryoprecipitate or DDAVP. And then, if we go further down the page, paragraph 2 is recommendations to factor VIII concentrate manufacturers. Serious efforts should be made to exclude donors that might transmit AIDS. These should include, and then there's a number of steps, questioning directly individuals belonging to high-risk groups, surrogate laboratory tests, ceasing using plasma obtained from donor centres that draw from population groups in which there's a significant AIDS incidence. And then paragraph B is expedite the development of processing methods that will inactivate viruses. Do you have any recollection of whether within ARMA there was discussion of these specific recommendations?
Well, there obviously would have been. And as far as I can tell, looking down those, ARMA would have complied with all that.
But you don't record your own involvement in any particular discussions arising from this?
Oh, no.
Okay. And if we just then look back...
It's quite clear that ARMA, it's not from the document, but I know that ARMA complied with all those MASAC recommendations.
If we just go back towards the top half of the page, the recommendations for physicians, which were, and I summarise, but steering physicians towards using treatment other than concentrates as much as possible. that would have had commercial implications for companies such as Armour, would it not, if physicians switched to non-concentrate treatment? Do you recall that being discussed?
Not specifically, no. And the amount, the impact of that particular recommendation would have been fairly minimal, because the major treatment was, of course, the more severe patients, and those with inhibitors, for example.
Can you recall whether this particular set of recommendations from the States ever came up in discussions between you and your team on the one hand and Hemophilia Centre directors in the UK on the other hand?
No.
So you don't recall, or you don't think they were discussed?
I don't think they were discussed.
Can we then, still sticking with 83, and I'm trying to go through some documents chronologically, Mr. Bishop, in the interests of simplicity. If we go to ARMO 40236, please. This is a letter, 15th of March 1983, from Dr. Kernoff at the Royal Free to you. The heading is Proposal for Research Support into AIDS at the Royal Free Hospital. Further to our previous discussions, I now enclose a brief formal proposal requesting support for our AIDS-related project in haemophiliacs. And then he sets out what's being sought, which is effectively the salary for a year of a senior technician. If we go over the page, we've got the brief research proposal there set out, and the background is in paragraph 3. If we just look at the second paragraph under that heading, the causes of these abnormalities, and that's a reference to immunological function abnormalities, are unknown but may include transmission of a previously unrecognised virus or other agent. And then it goes on to say the possibility that infusion of essential therapeutic products may be complicated by very serious hazards is causing extreme concern amongst patients and those responsible for their care. It's been suggested that profound changes may have to be made in management practices, particularly as regards the use of imported commercial concentrates. We regard the acquisition of further information about the immunological defects in haemophiliacs and their relationships with clinical disease and blood product exposure to be a matter of the highest priority. So that's a brief summary of the background to Dr. Kernoff's request. If we just go back to the first page in the letter, it would appear you'd had discussions with Dr. Kernoff about this project. Can you recall anything about that?
Not specifically, no.
Why would this request for support for research be coming to you rather than your medical department?
Well, so from there, it's obvious we had previous discussions about doing such a research.
Within Armour, whose decision would it have been to agree to funding of this research?
Sorry, what?
Within Armour...
Sorry, can you repeat that?
Yes, of course. Within Armour, whose decision would it have been to agree the funding for this research?
Right, it would be a decision between the UK medical department and with the approval of the US medical people and research people.
If we just look at one follow-up letter from you on this issue, ARMO 40238. This is you to Dr. Kernoff, 7th of April. It would appear from the first paragraph that there's been potentially some revision to the protocol by Dr. Townsend, and it refers to discussion by the Revlon Plasma Executive Committee on the 30th of March. Was the Revlon Plasma Executive Committee UK or US based?
UK. Sorry, US. It was called CPEC, Plasma Executive Committee.
And then there's an invitation to Dr. Kernoff and Professor Janissy to come to Eastbourne and essentially do a presentation on the proposal. Would you have been involved in listening to or assessing that presentation?
I would have probably sat in the corner in the back row or something, but I would have no input into it at all.
Would it be fair to say that you would at least have understood from your discussions with Dr. Kernoff and what he'd set out to you in his letter that the possible connection between factor concentrates and AIDS was a matter of some significant concern to clinicians by this stage?
Yeah.
If we then look around the same time at your interactions with Dr. Preston in Sheffield, ARMO 40239. This is a letter from you to Dr. Preston, 21st of April 1983. Dear Eric, re-proposal for research support into AIDS at the Royal Hallamshire Hospital. And then there's a similar invitation to Dr. Preston, together with his colleague, Dr. Trigger, to undertake a presentation. Again, would you have, is it right to understand, you'd have sat in probably and listened to the presentation so you'd know what was being discussed and why, but you wouldn't have been deciding on whether to fund the work?
Correct.
And then if we just go to one further document about this particular study, ARMO 40251. So this is not a letter from you. It's to Dr. Preston, but it's been sent on behalf of Dr. Townsend, and it's a draft protocol. If we go over the page, we can see the heading draft protocol for investigation of immunological status of haemophiliac patients with associated liver disease. I'm not going to ask you to look at the detail of it now, Mr. Bishop, but if we go to the final page, you'll see there a heading ethical approval. Ethical approval will be obtained from the Ethical Committee of the Royal Hallamshire Hospital, Sheffield. And then a heading written informed consent. Written informed consent will be obtained from adult patients or from the parents or guardians of any children who agree to participate in this investigation. Do you know whether ARMA would have taken steps to satisfy itself that both ethical approval and true written informed consent was being sought and obtained, or would it have just trusted to the doctors involved to do that?
It would be up to the doctors to do that.
So, looking then at the materials that we've just considered from January through to April, Mr. Bishop, would it be fair to say that by April 1983, you, as manager of ARMA's Biologicals Division, would plainly have been aware of the threat of AIDS and of advice in the States, at least, to clinicians to use concentrates less. And you'd have been aware that clinicians in the UK were starting to undertake research studies into AIDS.
I would have understood that, yeah.
Well, did any of those matters lead to any change of approach by ARMA to the selling and marketing of its product, or was it very much business as usual still?
Yes, business as usual, unless there were significant directives to amend that from the medical department or the US.
Let's look then next at a telex that you sent at the end of April 83. It's ARMO 40242, please, Shomik. So we can see it's from you. Your name appears at the bottom of the page. The date is the 27th of April 1983. It's for the attention of Anita Besler in the States. whose role we've already discussed, and then it's copied to a number of people. Could you just help us with understanding who Mr. I. Regier in Paris was?
He was he would have been at the Paris branch. I forget what they were. They had a branch in Paris, which he would have been heading up.
Can you recall, was he marketing as well, or was he in a medical or regulatory capacity there?
No, he was a vice president, okay. But essentially sales and marketing, I think he was. Yeah.
And then we can see the subject of the telex, AIDS armour policy. Further to our telecon 26th of April, I would confirm that the circulars sent by Travenol and Cutter to the UK Hemophilia Centre directors are on their way to you, and that sent by Alpha will be following shortly under separate cover. I would like to emphasise the urgency of a similar definitive statement from our own operation along similar lines, together with a more simplified statement which can be passed on to the increasing number of UK haemophiliacs who are beginning to ask questions of their individual centres. I understand that Ingo Regier will be discussing this with you in detail. I should like to receive your recommended circular, painting as positive a picture as possible and emphasising our small batch / donor pool sizes. What was it that you were after here, Mr. Bishop, and why were you concerned?
Well, without sight of those circulars by Travenol, Cutter and Alpha, I don't know, except that there was something in there, either criticising the armour procedure. That's all I can assume from this document.
The reference in the second paragraph to a more simplified statement would suggest that you were envisaging not just something to go to UK Haemophilia Centre directors, but something which they could themselves pass on directly to patients. Is that the right way to understand that? And then the third paragraph...
Yes, we wouldn't advise, we wouldn't go directly to the patients themselves.
No, you were producing something that the clinicians could give to the patients. Is that right? That's what you were suggesting?
Information which would pass on, yeah.
And then, what did you have in mind when you talked about painting as positive a picture as possible?
Well, emphasising the benefits of our own procedures and product, and if appropriate, nullifying any criticism that appeared in the Travenol, Cutter and Alpha directives.
And was the aim of getting some kind of statement or statements along these lines to try and ensure that clinicians would still treat patients with armour product and patients would continue to accept treatment with armour product?
Yes, of course. That was my responsibility as a marketing person.
If we then turn...
obviously dependent, of course, on the safety being paramount, not just thinking of the sales aspect of it.
We'll come to look in a moment at what I think is probably the statement that was produced following your suggestion, or one of the statements produced. But before we do that, the next document chronologically, May the 3rd, 1983, is ARMO 40244. This is a joint memo from you and Mr. Christie to Mr. Fitch, subject factor rate and AIDS. And then you say in the first paragraph, the potential problem of AIDS and products of human blood origin has been identified since the early part of this year. Increasing numbers of clinical papers, reviews and letters in the world medical press has highlighted this condition, which has a high mortality, a puzzling set of symptoms and is of unknown etiology. The disease was originally thought to be restricted to homosexuals, but it's now known that while those affected are usually, 75% of cases so far, homosexuals, the remaining 25% are recipients of blood products or donations, drug abusers, infants of affected AIDS victims and Haitians. And then there's reference to cases being reported in various parts of the world. There's then a description about publicity in the press over the weekend. I'm not going to go through the detail of that, Mr. Bishop, but you refer to a publication in the Observer and the Mail on Sunday. Or you and Mr. Christie jointly refer to that. If we go over the page, the second paragraph says this: since the 11th of January, we've been in constant touch with Messrs. Regier and Kelman and direct to the US to attempt to obtain a specific policy statement suitable for transmission to haemophiliac centre directors. And then there's a reference to a European task force having agreed on action to be taken. Can you assist us any more with what the European task force was and ARMA's involvement with it?
I don't recall a specific body of the European task force. Again, I think it was probably a collection of medical and marketing people.
And then
between UK and Germany.
If we go to the bottom of the page, it says, in spite of repeated follow-up, we've not yet received the data and reassurance that we need to prepare a policy document, press release or updated authoritative advice to our sales force. In view of the recent adverse publicity against US imports of blood products, it is vital that we promptly issue our policy document, particularly as all but one of our competitors have already done so, and we're under increasing pressure from our customers to do so as market leader in the UK. Would it be fair to understand, Mr. Bishop, that what you wanted was something that could be provided to haemophilia centre directors to provide a degree of reassurance that ARMA's product was safe or as safe as its competitor products?
Yes, yeah. That's exactly what it wanted, yeah.
And then if we go to BART 40863, this is a document dated the 19th of May 1983. It's to all haemophilia centre directors. If we go to page 5, we can see it's from Mr. Fitch, Chairman and Managing Director. And if we go back to the first page, we see the topic is AIDS. But before we look at the contents of some of this, is it right to understand that this is the policy statement that you and Mr. Christie had been pressing for?
Yes, it would appear so.
And we can see it's directed to all haemophilia centre directors, and then it says in the first paragraph, ARMA is acutely aware of the current concern of the medical world regarding AIDS and its possible implication to haemophilia care and treatment. And then this, despite the fact that there is little evidence to associate plasma component therapy with the transmission of AIDS, ARMA, through its affiliate organisation Plasma Alliance, has had programmes in operation for several months designed to help prevent the utilisation of plasma obtained from members of high-risk groups associated with AIDS in the production of clotting factor concentrates. The use of little evidence, is that a correct reflection of the position as at May 1983, do you think?
The addition of the word proven would have been appropriate, I think, looking at it, despite the fact there's little proven evidence or substantiated evidence.
Was ARMA trying to downplay the causal connection between concentrates and the risks of AIDS?
No, it's just trying to reflect the current scientific thinking.
Can you just help for a moment with the words you've just used there? You spoke about little proven evidence or little substantiated evidence. It might be thought that evidence is evidence. What is proven evidence as opposed to evidence?
Well, it's just terminology, isn't it?
Well, that's why I'm asking you, because it's your terminology, and I want to understand what you're trying to say.
Well, Well, substantiated proof, I suppose.
I see. So you're looking for more than evidence. You're looking for evidence which amounts to substantiated proof.
Yes.
I see. Thank you.
If we go on to page 3 of this document, we can then see a discussion of various matters relating to measures that could be taken. And the second paragraph of this letter refers to what's sometimes called surrogate testing. So if we pick it up in the 4th line, testing of AIDS patients for antibody to hepatitis B core antigen shows that over 85% of them are positive for this marker. However, extrapolation of these findings to a general screening programme in order to identify potential AIDS victims or carriers may not be practical. Do you know whose decision it was to take this particular approach to the use of hepatitis B core antigen testing?
That would be a US decision.
So are you able to assist us in understanding why it was said that that it may not be practical to extrapolate those findings to a general screening programme?
No, I don't.
If we then go towards the bottom of the page, we've got a heading, Plasma Collection and Utilisation by Pharmaceutical Company USA, and then there's a reference to Plasma Alliances Centres. If we go over the page, the second paragraph talks about the display of informational posters at centres from December 1982 onwards, and there's a very broad description about what the posters advised. And then the next paragraph deals with what's said to be a more aggressive programme initiated in February 1983, direct questioning of donors, written and oral information and questions. Do you recall whether you ever saw the actual posters or questionnaires themselves? Or were you simply reliant upon being told that this programme was in operation in the States?
I didn't see the actual posters themselves, no, but I would rely on the integrity and honesty of the information that was being fed back to me. No reason to doubt what they're saying.
Do you recall receiving any feedback from the Hemophilia Centre directors that you or your team were visiting about this statement?
No, don't recall.
And then if we could turn to ARMO 40252. This is a letter from you, 24th of May 1983, to a Dr. College. It looks from the address as though it's a letter to a general practitioner. So if we go to the second page, we can see that this is a letter from you, C. Bishop, Manager, Plasma Division. If we go back to the first page, I just want to ask you about the terms in which you were writing to this doctor. We acknowledge receipt of your letter of the 10th of May asking whether we're able to supply non-American material. Presumably your letter's been prompted by the enormous publicity given to the subject of AIDS and the possibility that you have a haemophilia patient under your care at the present time. Much of the publicity, as you know, has been emotive and to a great extent inaccurate. Conversely, there have been a number of well-informed authoritative publications which have done much to place things in their true perspective and to allay many of the fears and the concern felt by the UK patient receiving regular blood component therapy, and in particular the UK haemophiliac. And then you refer in the next paragraph to Haemophilia Society publications, a letter from Professor Bloom and an overview of the AIDS situation by Dr. Kernoff, and you say we hope will help to further reassure the UK haemophiliac and those charged with his care. You then go on to talk about the ARMA's collection processes for plasma in the States. And then bottom of the page, we can see the phrase little evidence again. Despite the fact that there's little evidence to associate plasma component therapy with the transmission of AIDS, ARMA, through its affiliate organisation Plasma Alliance, has had programmes in operation for several months. And then top of the next page, we're firmly committed to providing safe and effective products to the medical profession. We'll continue to devote our energies and resources to the problems associated with AIDS and haemophilia treatment, and we'll continue our efforts to resolve them. If we just go back to the first page, it might be said, Mr. Bishop, you're speaking here in fairly strong terms. You talk about erroneous publicity, emotive, to a great extent, inaccurate. Why did you regard the publicity in those particular lights?
Well, because I was reflecting the state of art knowledge at the time.
When you say in that third paragraph, there being well-informed authoritative publications which have done much to place things in their true perspective, what did you mean by true perspective?
Well, the pros, the arguments for and against, the problems.
If it
To reflect the balanced opinion of the leading opinion formers, not only in the UK but internationally.
If it were to be said that what you were trying to do here was to persuade the doctor that there was no real reason to be concerned about the use of armour concentrates, would that be a fair observation about this letter?
This doctor obviously had a haemophiliac patient who expressed concerns to him, and the idea of this letter was to just to try and reassure him and his patient, and if he passed it on to his patient, just to reassure them and to update them with the current thinking.
Would you accept you don't say here, Mr. Bishop, well, there is a risk or there is a likely connection, but we don't yet know the true extent of the risk, or words to that effect, do you? It's all very much on the positive side of trying to dispel concerns, is it not?
Yes. Which with the state of art knowledge at the time, it would be quite wrong to cause consternation with individual patients until more was known and the science and knowledge evolved.
Ask you about one further letter from you. This is to Professor Bloom, ARMO 40265. Letter from you, 21st of June 83, refactorate batch number T40405. And then the first paragraph says, I'm very grateful for your letter of the 9th of June on the subject of the above, and for advising us of further details relating to the patient involved. Unfortunately, we've still not heard officially from Dr. Krask, and therefore the information you've supplied has assumed even more importance and enabled us to provide further feedback to our colleagues in the USA. And then you talk about the record-keeping facilities that would enable you to trace the location of vials and the traceability of batches in the States. Just looking at that first paragraph, unfortunately, Mr. Bishop, we don't have, or haven't been able to find, the letter of the 9th of June to which you were responding. But it would... the timing would suggest that this may have been a letter about the patient that we know to have been under Professor Bloom's care, who was said to be the first haemophilia patient in the UK to be displaying signs of AIDS, and the fact that that patient had received, amongst other treatments, a particular batch of factor VIII. Does that trigger any recollection of this discussion, Mr. Bishop?
No, not really. Unless I see Dr. Bloom's letter of the 9th of June, I can't really comment any further on that.
In that case, perhaps you can help us more generally. If this would appear to be the case, a particular batch had been implicated as possibly involved in the transmission of AIDS to this unfortunate patient, what steps would you expect ARMA to be taking in response to that information?
Well, the information would be fed back to the medical and the US, and then I would be directed by whatever the the experts decreed.
Would you
If
expect... Sorry.
it turned out, for example, that the material was one of the donors contributing to that batch of material had gone down with AIDS, then yes, one would expect the product to any product from that to be withdrawn.
Would you expect contact to be made by ARMA with other centres to whom that particular batch had been supplied, vials from that batch had been supplied?
Well, if it was appropriate to do so, I mean, if it was just an isolated case, and there was some evidence to, implicate that the material produced from that batch, then action would have been taken appropriately.
Do you know now what, as a matter of fact, ARMA did do in relation to that batch?
No.
Last question before lunch, Mr. Bishop, and this really takes us through to the middle of 1983, July of 1983. We know from a letter you wrote to Dr. Preston, I don't think we need to look at the letter itself, that you attended the World Federation of Hemophilia conference in Stockholm in mid-1983. You write to Dr. Preston saying it was nice to meet you there, or words to that effect. What recollection do you have of attendance at that meeting in Stockholm and any discussions about AIDS, or any presentations by Dr. Bruce Everett, for example?
No specific recall, no.
If there were...
This was
Sorry.
No, this was an annual meeting which we attended, and
would you have attended alone from ARMA, or would other colleagues from ARMA UK be likely to have attended with you?
Again, this is what we took pride on, that we involved all our specialists in attending that conference, so that they could sit alongside their customers and the experts and hear the same evidence, the same clinical presentations, so that their credibility when back in the UK talking to one of their customers, their credibility would be questioned.
So whilst I appreciate you can't remember the specifics, if there were discussions and presentations on the topic of AIDS at the Stockholm conference, as we understand there to have been, you'd have expected either you or your colleagues would have been in the audience listening to that?
Definitely would be. Yeah. And the outcomes of those presentations would be in the abstracts of the conference. We had them.
So is that a convenient moment to break for lunch?
Yes, it is. So we'll take a break then until 2 o'clock. 2 o'clock.
Thank you, sir.